Well, thank you all for coming. Today we're going to be talking about how to access reproductive health services during COVID and during lockdown.
Yeah, so first, just in terms of short-term birth control, first there are over-the-counter methods like condoms, spermicide, and the morning after pill. Also important to note that Plan B is available to anyone of any age and should work for up to 5 days after having unprotected sex. And these over-the-counter methods are generally still available at your local Walgreens or other drugstores. But if you are looking for methods that require a prescription, like the pill, patch, ring, or the shot, although there are restrictions in place right now, it's still fairly straightforward to access these methods through scheduling a virtual appointment. So, for example, you can contact your local Planned Parenthood Health Center either by signing up online for an appointment or just calling in. And there they will connect you with a medical professional to set up a sort of video chat style thing, just where the doctor will ask you about some previous health conditions you've had that might lead to complications with birth control, like high blood pressure or diabetes. But then once that's been approved, you can start getting a consistent supply of refills. There are also some private companies like Pandia Health. So Pandia specifically offers the pill, the patch, and the ring, and they can walk you through every step of the way to get that birth control delivered either directly to you at home or to your local drugstore. And so if you don't have a prescription already, you can fill out a short form that takes less than 5 minutes on their website. Again, just asking you about stuff like again, your health conditions, just to make sure you don't have any conditions that could put you at risk for these more possibly dangerous complications of birth control. But once that's been approved by a medical professional, again, you can start getting these forms of birth control either delivered to you directly or again, picked up at a local drugstore if that's preferable for you. Um, and yeah, so Pandia, sorry, can you go back? Yeah, so Pandia does offer financial assistance in case any of the prices of these prescription forms are a barrier to you. So just that initial consult with a doctor is going to be about $20 just to have them read over your health form. And then without insurance, the pill is about $45 for 3 months worth. The patch is about 150 for a month, and the ring is about 250 for a month. But they do have a section on their website where you can sign up for financial aid and just have to provide some sort of supplementary form. I know they also accept like college financial aid, like your like cost of attendance sheets, just so they can get an idea of just some sort of verification for the fact that you need financial aid with this. And then they do accept most forms of insurance as well. Yeah, next. But then in terms of long-term reversible contraception, so that includes the hormonal and non-hormonal IUDs, as well as the implant. This is going to be a little more difficult to get right now just because these forms of contraception require a minor surgery. So it's generally recommended that for now you just continue to use short-term birth control, since yeah, the long-term forms just might not be as accessible right now. But if you do have a specific set of circumstances where you feel like you need these more long-term methods, you can set up a telehealth consultation with a Planned Parenthood professional, and they can talk through your plans with you. And then it might still be possible to get these long-term methods at your local Planned Parenthood health center or through your gynecologist. Largely depends on location. Um, but yeah, the general recommendation is to just wait and continue using these short-term methods. And of course, as lockdowns start to ease up and lift, things will return to normal and these should become more accessible in the future. And then in the case that you currently have a long-term form of contraception and you're thinking of maintaining it, but it's either about to expire or already has expired, in the case of IUDs, the biggest risk here is definitely just infection. Um, because as the IUD is in place, it starts to develop a bacterial film. And so the chance of this film developing just a few months after your IUD has expired isn't huge, but of course that risk will go up with the longer it's in your body. Um, but it's also important to note that in terms of efficacy, most IUDs last longer than advertised. So those higher dosage hormonal IUDs Like the most common ones, Mirena and Liletta, are usually advertised to last about 5 years, but studies have shown they can really last up to 7 years. And so if you are thinking of keeping an IUD longer than longer than that said expiration date, just be sure to schedule a consultation with a Planned Parenthood professional just to talk through your specific risks of pregnancy. And then in terms of the implant, these usually don't last longer than advertised, so they won't really serve as effective methods of birth control after that 3-year mark. But there isn't the same risk as infection. But of course, with any foreign object that's in the body, it could lead to complications if you keep it in longer than recommended. So just be sure to ask a doctor or Planned Parenthood medical professional if you have any questions specific to your situation and your plans for your birth control.
So I'm going to be talking a little bit about abortion services during the COVID-19 pandemic. As of now, most Planned Parenthood health centers are still open, although some of them have limited hours or limited services. So if you're interested in going to a Planned Parenthood, make sure to look before you go and see what services and hours they're offering at the moment. Most of them currently are still offering abortion services, including the Mountain View and Redwood City locations. So if you're near Stanford. And Stanford Healthcare is also offering abortion services at the moment. So if you're also near Stanford. Regardless of where you are, though, there's been a rise in the role of telemedicine and medication abortion. So basically, there's two types of abortion: medication abortion, which you can do at home, you take 2 different pills, or surgical abortion, which is what people usually think of when they think of an abortion, where you go into the doctor's office. But with the COVID-19 pandemic and lockdowns and quarantine, there's been a big rise in the role of telemedicine and medication abortion, because you can just video chat your physician and get prescribed medication for the medication abortion and then take it at home in order to reduce your risk of exposure to COVID-19. You can have an abortion in the safety of your own home. This is just a study on what I was just talking about. This came out early in the pandemic, but Stanford researchers found that these self-managed abortions, these medication abortions at home, are a safe, effective option, especially during COVID-19. So it's important to keep in mind. And then the last thing I'm going to touch on a little bit, it's less relevant now than when we had our last reproductive chat in the spring. But in the spring, at the beginning of the COVID-19 pandemic, a lot of states, the ones shown in green, were attempting to pass abortion bans, claiming that abortions are non-essential services, and kind of comparing them to things like cosmetic surgery and non-essential knee replacements and things like that, claiming that they were taking personal protective equipment, PPE, away from the doctors who need it for things like COVID-19. However, as you can see, now all states have abortions permitted. So the green states either got shut down or is in the process or is in the court system right now. But regardless of where you live, if you live in the United States, abortion should be allowed. Not sure if you live internationally. Oh, one other thing. Can you go back? Also, our political climate may be changing in the next few months, especially the Supreme Court may be changing. So just make sure to keep up to date on what's going on in terms of your abortion rights, and consider what may be happening in terms of changing abortion rights in the future.
Cool. Thank you, Allie. I'm going to be talking a little bit about STD testing and treatment. So as we've talked about, many clinics and medical facilities are operating now under modified rules or modified systems. And so a lot of them, like as this, pandemic lasts longer and longer, people are finding ways to make it, life still go on. And so medical facilities are generally open now, but if they're seeing limited patients, STD patients with symptoms are definitely prioritized, and that goes for Planned Parenthood as well. And so if you are presenting symptoms, it's definitely like more of a priority to get you in rather than, you're somewhat concerned about or just getting like your like biannual STD test. So if you don't want to go into a clinic or you don't have symptoms or you or someone you live with is immunocompromised, another good option is at-home testing kits. There are many, many options for at-home testing kits. If you Google like at-home STD test, you'll see just a million companies pop up. And so these companies, like there are a lot of things to consider when you're picking a company. The first thing is that cost is definitely like a huge factor. There's a huge range. I said $50 to $300, but honestly, I saw many that were below and above that range. And some of them accept insurance. So definitely look into if you have insurance, look into the ones that accept your insurance, because that'll make it more affordable. Another big factor is that they have different ranges of like STD tests that they test for. And so you can pick a company that tests like generally for a bunch of different STDs. That's definitely going to be on the higher end of cost. But if you are presenting with symptoms that you know are correlated with a certain STD, or you want to talk to us, one of us, and we can help you figure out what STDs correlate with your symptoms, you can pick to just get tested for a certain STD. So if you are having symptoms that align with chlamydia, you can pick a company that will just test you for chlamydia and get that result, and that will likely be cheaper. But that one does require you being able to like confidently pick an STD that you think that your symptoms show. Planned Parenthood is still open. Most Planned Parenthood centers are open. As I think Ali said, they might have modified hours or days that they're open. And they're definitely prioritizing time-sensitive procedures. So if you don't have a time-sensitive procedure, they might refer you to telehealth. And STD testing and treatment falls under this because that is something that you want to get taken care of sooner rather than later. And you'll probably have varying wait times for actually getting into a Planned Parenthood center. Generally, it does take around like 2 to 3 weeks in my area, at least, to get into a center once you like go on their online portal and request an appointment. I've been seeing that the wait times actually might be less now that like during the pandemic, because I think probably more people are referring to telehealth services. And so, yeah, that's definitely something to look into. And also that is just for my area. It could be totally different. But Planned Parenthood does have an amazing online like access to scheduling your appointments. And so you just go online and you can like schedule it right then and there. And yeah, so then I'm going to talk a little bit about virtual healthcare. So with Planned Parenthood specifically, they have this app that you can get, and you can have a chat with a Planned Parenthood, someone from Planned Parenthood. It could be a doctor or a PA, someone at Planned Parenthood that can help you will be on that other end of that chat. And so with Planned Parenthood, it generally is that chat. But other physicians will do Zoom or like video visits. I'm not sure if they use Zoom because it does need to be like HIPAA approved, but it'll be some other video format. So if you have a situation that requires like talking more, that would probably be preferred. Yeah, and you can get treatment, like STD treatment prescriptions through doing a video visit like that. The last thing to note is that you probably will have to wait much longer for your results right now, because a lot of testing companies are like, at max capacity with COVID-19 testing. And even with COVID-19 testing, like those wait times are taking longer than they should. And so it might take a while for you to get your results. So that's one thing to note, that if you are having symptoms, definitely like get on the ball with getting tested earlier so you can get your results earlier.